and to understand the inflammation. So I will explain first cellular injury. Human, human pathology is manifested at the cellular and organ level. Cell survival depends on the maintenance of a homeostasis or stable internal environment which requires a constant supply of metabolic energy and active transport process. Prior to the microscopic appearance of the cell injury, critical alteration of the basic biochemical pathways must occur. When this homeostatic state is disrupted, the cell first adapts to the change. If the cell is unable to fully adapt, cell injury ensues. Injury is at first reversible but may progress ultimately to irreversible injury and cell death. The ability of cell or organ to tolerate injury depends on the severity, duration, and type of insult, as well as the adaptive capacity of the tissues. Now I will explain the causes of the injuries. Number one, hypoxia. Hypoxia or lack of oxygen leads to the mobility of the cell to maintain energy in the form of ATP. The loss of ATP production has multiple consequences. Hypoxia can result from loss of blood supply like ischemia due to decreased arterial flow, a decrease in oxygen carrying capacity of the blood due to the anemia or carbon monoxide poisoning, like co-produces a stable complex with hemoglobin, blocking oxygen transportation, or poisoning of the enzymes of oxidative phosphorylations by toxins such as cyanides. Then second cause is chemical injury. Chemical injury can lead to a disruption of physical structure of the cell or to a breakdown of biochemical process of the cell. For example, chemical can alter membranes permeability or block the action of an enzymes by binding either to the enzymes or to its cofactors. Third cause is physical injury. Injury includes mechanical trauma such as crush injury or gunshot, wounds, burns, heat, frostbite by cold, radiation, and pressure changes. Fourth cause is infection. Infection encompasses a wide range of problems, including bacterial, fungal, parasites, and viral organisms. Virtually all aspects of cellular metabolism can be affected by these biological agents. Various invade cells can elaborate proteins that are toxin to the host cell and cellular metabolism. Bacteria can release exotoxin, for example, phospholipase, or produce endotoxin, for example, lipopolysaccharides, from their cell walls. Other agents such as parasites can cause the host to initiate a cellular, for example, Duraitalis macrophages or immunological reaction to the invaders. Fifth cause of immunological reactions, although the immune response is tightly regulated, it can result in injury as manifested by an anaphylactic reactions or autoimmune diseases. Sixth cause genetic disorders, which leads to biochemical abnormalities, can lead to the accumulations of toxin product or the inability to metabolize. various compounds due to enzymes defects, for example, cystic fibrosis, sickle cell anemia. In addition, rearrangement of genes can predispose cause uh, individual to cancer by altering normal cellular homeostasis. Seventh cause nutritional or vitamins deficiencies, for example, beriberi, scurvy, hypervitaminosis, especially vitamin A, B, and D, inadequate calories intake like marasmus, or inadequate proteins intake kwashiorkor. Eighth cause are aging. Aging can lead to the breakdown of normal cellular machinery, ultimately leading to death of the cell. Now, I think everybody can understand what is a cellular injury. Now, I will explain the definition of inflammation. The reaction of the living tissues to injury infection caused by irritant. So, it is a defensive mechanism which is activated when there is a cellular injury appears. So, uh, are you listening?
Yes, sir.
Hello.